A warm welcome to all of you for the day 2 of ANEICON 2023. May I request everyone to please take over your seat. Hello ladies and gentlemen. Good morning. Good morning. Yeah, how's the Josh? That's it. Lovely, beautiful smile I can see. So, if time is money and we have invested then at the right place at the right time, we have banked a lot of saving interims for knowledge, technology, transformational leadership towards futuristic nursing. To further invest, how many of us loves to invest? Nobody wants to invest money? Yeah, that's it. If you want to further invest, I request all of you to become an ANE member. Because when you register yourself for ANEI, that has nothing to subject to any market risk. But I assure you that it is going to be full of benefits to you all, with a lot of knowledge, meeting, greeting, understanding what is our nursing doing in India and what is our future role going to be. So, for a better return policy and further information, you want to log into www.anei.in. So, before we start, once again, it's my privilege to welcome each one of you gathered here. And before we proceed, I have to spell out the do's and don'ts once again. Please do not touch the iPad fixed behind the chairs in front of you. Do not litter, and no eating, no drinking is allowed inside the auditorium, please. Kindly switch your mobiles to your silent mode. I have few requests again to our dear faculty. Please stick on to the time. Otherwise, remember the ambulance sirens will be behind you again and again. So with this note, I welcome all of you once again.
Let's recapitulate our yesterday's highly informative, power-packed scientific sessions. We had 5 tracks including the inaugural. Track 2 was on modernizing healthcare, which was focused on future of nursing in India, unsiloing nursing, bridging gaps between nursing education and practice, and transformation of nursing using AI by our renowned leaders in healthcare. Track 3 was about invest in nursing, recruiting or retaining, which was a panel discussion where eminent speakers shared their insights and had put forward their valuable suggestions on the theme. We had brilliant views presented by our national finalists on the topic Contribution of Nurses to the Future of Indian Healthcare and Preparing Nurses for the Future by our staff nurses and student nurses in Track 4. We had an exciting discussion on cooperative learning, which was fast-paced with new knowledge tools by our eminent speakers. We once again thank all the chairs and speakers from yesterday's session. Today we are here gathered yet with another exciting knowledge-filled, interesting sessions. So ladies and gentlemen, let's have a huge round of applause for all of us for being the most prized delegates for this prestigious flagship event, ANEICON 2023.
A round of applause. The future of healthcare leadership is all about creating consumer-centric organization, and today's focus is to build more nurse leaders by enhancing their business skills. May I call upon Ms. Josephine Cyril, founding member ANEI, to chair this session. Ladies and gentlemen, welcome Ms. Josephine Cyril. Also request the speakers to come on the dais, please. Captain Ajita Nair, National President ANEI. Ms. Subhada Sakurikar, former National Secretary ANEI. Mr. Mayank Ratola, Group CHRO, Care Hospitals. Dr. Purnima Prabhakaran, Director Center for Health Analytic Research and Friends, Trivedi School of Biosciences, Ashoka University, Senior Research Scientist, Center for Chronic Disease Control.
I take this opportunity to introduce our esteemed chair for today's session, Ms. Josephine Cyril, Chief Nursing Officer at Sri Gangaram Hospital, New Delhi. Ma'am had been awarded with Nursing Excellence Award from Kingdom of Saudi Arabia. She is the co-author of textbook on emergency medicine including intensive medicine and trauma published in 2022. We request ma'am to take this session forward.
Good morning, everyone. So, we had a power-packed day yesterday with a lot many discussions, lot of learnings, and today my topic, in fact, my work has been reduced because most of the things are covered yesterday. The theme for today is futuristic skills for leading healthcare. I have very expert speakers today with us. Two more, Dr. Nageshwar Reddy is not in town. Mr. Mank and Dr. Purnima, I believe they are on the way. And warm welcome to the speakers, Ajita and Shubhata. Futuristic skills for leading healthcare. Very interesting topic. And if you look at this year's International Day theme itself, our nurses, our future. And yesterday from morning we had been hearing about how we nurses have to transform into various roles to meet the highly complex healthcare system which is changing every day with the new demands, new challenges. Yesterday when I was preparing for this session, I understood one thing. Today as in the opening itself as Ms. Ishita said, today healthcare organization is looking at a consumer-centric, forward-thinking, and three primary areas they are based on, which is very much matching with my topic today. So the three primary points which our team is going to talk, many of the things they will be covering. The customer out there is so concerned about the cost factor. The cost factor. And our first speaker is going to talk about the business skills we require, understanding the business skills. Just on a lighter note, recently we had senior nurses gathering with the top management in the auditorium where I am working. You won't believe the top management, while addressing 80% of the time, they were only telling the senior nurses 10 years and above that they need to be very conscious about the cost, especially taking care of biomedical equipment. Number two is, after the cost factor comes the quality. So number two is quality of data, quality of care we give. So this is what the organization have to think about. We keep hearing about quality, but we have to make it happen. It is not just collecting the data, the outcome of that data. And the last but not the least, technology. We had been hearing yesterday all about technology. Again, we will hear again, starting with the AI and remote patient monitoring. In fact, I was reading yesterday even nanomedicine, robotic surgeries, telemedicine, telehealth, and one very interesting thing came up while preparing for this day, that tele-psychiatric counseling, mental health issues. Around 1 billion people around the world have mental health issues by the age of 40. And nurses have a huge role to play. Because it's a stigma that people don't come to the hospital, where we can contribute, and in their private rooms we can do counseling and participate in the care. So all together, future is looking very bright for nurses. Now let me introduce my first speaker, Madam Ajita. She doesn't need an introduction. We keep hearing about her, seeing her at every forum, and even in this month, in the first week of May itself, we were together in one forum in Kerala. So Madam is right now Managing Director, Heal-Biz Healthcare Management Solutions Limited, and she was also she's a Chief Operating Officer for Avitis. That was her previous role. Chief Nursing Officer, Aster Medicity Kochi, Chief Nursing Officer, Maitra Hospital, Chief Nursing Officer, Fortis Healthcare, and Director of Nursing, Ruby Hall Clinic. This was her past career, and of course she is a postgraduate in nursing, and she is ANEICON President. So huge round of applause and invite her to the dais, and she is going to talk about understanding business skills. Welcome, over to Ajita.
Good morning, everybody. Very happy to meet you again in the morning. Very pleasant morning today. Thank you, Josephine ma'am, for that introduction. I'm supposed to talk to you about business skills required for nurses. Well, business skills is required for everybody for life, right? And I never thought I have it. I don't have it, actually speaking. I'm a very bad person as far as business is concerned. Why? Because in all our minds, we think business means, taking advantage of a situation, or business is making lot of money by unethical means. So we have all these kind of thoughts coming to us when you talk about business. To tell you the truth, when I left armed forces and went to my first hospital, Fortis Hospital, Mohali, that was in 2005-06. Tangam was there as the CNO of that place, and I was supposed to take over from her, and I was actually speaking a bacha, because I had the 14 years of experience, but then in looks, and madam can recollect my face at that time. And looking at a patient's bill there, I used to get so irritated. I used to get so angry, because I was lucky to be in a place where our education was free. We hardly spend money for education of BSc nursing, because I did it from AFMC. A lot of my colleagues, senior colleagues, Captain Usha Banerjee is a senior colleague of mine there. She was senior student. Aji is there. So a lot of people are here. Okay, so it was free. Okay, so and the entire hospital is free. We never had to ask the patient money. So we did not have much of a concern about how much money we are spending for healthcare. Only these resources were scarce. So in that sense, we look at the cost of things, or we only knew that if you ask for 10, you will get 5, and you have to manage with 5. This was the business sense we had all the way. And when suddenly you are exposed to huge bills of patients, and they question you, when they spend money, you question, right? They question you. I'm sure all of you face these questions. And looking at the bill, I used to get really irritated. Oh my God, a lot of money is being made by the hospital. Then, as time would have it, we have to be on the other side, where you understand how all this been put up. Now we are sitting here and enjoying this facility. Do we have any idea each second how much money it costs being here in this beautiful facility? We never thought of it, right? We never thought of it at all, actually. The hospital authorities gave this facility free of cost to us. You see how much of money is being invested into nursing and to us. So this is very important to understand wherever you go, wherever you are working. Many of you work in very beautiful facilities, and the value of it we understand when you go to a facility which is not so equipped, right? I was working for past, since the time I started business 2 years ago. It's not literal sense of business anyways, but so 1 year my client was a medical college. The only AC room in that medical college is chairman's office. Rest of the place doesn't have air condition. And 1 year I worked there, and the room which I was staying was a student's hostel in the campus. So then I was reminded of all my previous years where I was, in a totally AC room, and this is in Kerala where it's so humid and high temperature. So what I am saying is, when we enjoy the facility, please remember this, that someone has invested their cost in that. How do we return that? Do we ever think of that? We have to return by understanding how much money per day costs for this kind of an auditorium. I absolutely have no idea of this, but I know it's very huge. So realizing that comes, then the business skill starts. Then you get into your mind that yes, resources are scarce. It is not in abundance. I mean, all of you are struggling with less staff in your place, right? Every place. That is resource. Less money. Whatever you ask, do you get ever? No. Whatever your children ask, do you give all that money to them or all that? No. So resources are in scarce. So this is another basic lesson what all of us have to understand, that resources are scarce. So use it judiciously. Use it judiciously. This is business skills for every day. So if the resources are scarce, the staffing is less, you have to learn something known as maximizing the outcome with less resources. So how can you have with less staff more patient outcomes? So that is what is budgeting means. So that is known as optimal staffing, isn't it? How many staff are required? You will not believe, now nobody is there from Astra Medicity. When I went to Astra Medicity as nurse director, what the first action of mine was to stop recruitment. I mean, isn't it surprising? It was not so long ago. 928 staff, I remember it because I have to do it. So 928 staffing with an average occupancy of 270. Hello? That is height of it, right? So I have stopped recruitment for 6 months. Then you cannot send anybody away, right? We don't do that. So, and in bulk people go 50, 60s every month's resignation, and within 3, 4, 5 months it became what the number meant to be. That wasn't the best method, but I did not have any other, way of, optimizing the manpower number at that time. I don't think any other nursing head would have done that. I have more nurses, but more nurses in number. So if you know the calculation how to do it, only you will be able to do. Otherwise, not. So optimizing the staffing is part of your business skills in a hospital. Why? Because it is in short supply. Do you know that in a private hospital about 25% of the total income you make goes out, 25 to 30% goes out to the manpower cost. 30% of the cost, so 30 to 40% of the cost goes to into that. That is optimal, okay? I am talking about optimal. And look at some hospitals, 60 to 70% is going to manpower. How do you run the hospital? You cannot. Okay, so we all nurses have to come out of our usual preparation of being a nurse, little bit, expand your vision, your field of vision. You usually look like this. This is my nursing department, this is my norm, this is not what I am supposed to do because you are looking like this. You can't see this side, that side. Okay? Is this a nurse supposed to do? All the time. So many people have asked me this question, that this is not nurse's job, why are you doing it? Your progress, so many people asked the question to the young nurses yesterday, what would you be like after 5 years or 10 years? The investment Yashida was talking about in the morning. The investment in your life is what you do outside your job description. Let me tell you that. You get a job description when you join, and your future depends on what you do outside that while being in that place. And if you do that, that means delivering more than expected for that role. People slowly start realizing it. If you do that, I tell you, all the empowerment comes. Many people say, looking at me that I give a aura of little bit being arrogant with people. Because I don't compromise. The only reason is not being literally arrogant, but I don't know, but maybe by nature, but too much of compromise is not possible with me. So that has been, you can call it different ways. But still people want me at job is only because of one reason, which at introspection I feel that the outcome is more than what they invest. I am giving you tips of how do you become, you in a crowd. You have 1,000 nurses, 2,000 nurses in one hospital. Bindu has over 1,000 nurses here, I am sure. So 1,000 nurses is a head count for the management usually. It's just head count. Nurses are not just head counts. Actually not. But we should understand that we are one in a crowd, and if you want to stand different, identified with your name, then you have to do more than what is expected out of you. And isn't it spending so much of time? No, don't misunderstand this. You don't have to spend 1 minute extra in the hospital for doing that. Seriously. I have 2, 3, 4 people from Kim's Hospital, Trivandrum, which was my last client. I call all of them clients, the hospital. So I am reminding myself that, hey, you are not a regular employee, you are a consultant. I am reminding myself. So maybe I should ask one of them to describe, they're sitting there and recording my talk, describe, I'm a consultant there, I can come off at 5 o'clock, but I did work just like how I worked at Aster Medicity or elsewhere as a nurse head. Why did I do that is because how do you, I still at this age have to be identified with my outcome and not what I talk, seriously not. The outcome when you sit on a CNO's chair in a hospital is so many things. All of you know that. What is the outcome? If there is something goes wrong with the patient, the first call comes to you. Why do you think Bindu is not even able to sit here in a chair? Because this is a very, very busy hospital. So your priority is patient care, patient safety, and Captain Usha always tells me, to what extent things can go wrong in a place, unexpected ways. All our years of service sometimes become absolutely useless. You don't know how to handle a situation. We ourselves, such seniors, because and we are alarmed that how can things go wrong in this way also. Every day is such new events in a happening hospital. Sitting here, I realize this is a happening hospital. A lot of patients. Wherever a lot of patients are there and a lot of complexities in care are there, a lot of things go wrong. As opposite to my previous client, that medical college hospital. Because though it is a medical college, there is no much complex things happen. There is no transplant, there is no heart surgery. So things are at a very moderate, manageable pace. There such drastic things doesn't happen. It's a reasonably safe place. But however we choose our workplace, right? So when you choose a complex workplace like this hospital, we have to be prepared for understanding the logistics of putting it together. If each nurse has that capability of understanding the complexities of how does all this happen, that is known as understanding of processes. So my request to all of you is that, shake yourself up, move yourself a little bit beyond while doing the job what you're supposed to do while doing. Let me reiterate that it's not you stop doing nursing and you go and learn something. No, while doing that you understand all other departments. You must know what is happening inside the pharmacy, or you must know what is happening inside in a finance department, or say for that matter in IT department. If you spend time in understanding those things, or how this our HIS works, we only know how to get into it. It's like how we manage our email. We don't know anything else, but we know to write mail and send it. We don't know the other icons we have not even touched. But understand how it happens, how you can make a new format in your HIS, say for example. All these things will make you stand apart from the rest of the crowd. And that is what, see, at the end of the day, all of us have to fight our battles alone. We may think that so many people are with us. No, many a times we stand alone there, facing the crowd, facing the question, facing a patient, which all the little nurses do. And they answer what you've been questioned for so many things, what others have done. You may not even know why you've been questioned, isn't it? So develop this understanding to be able to handle that situation in a much better fashion. Understand the cost. So don't just count that we have less staff, management doesn't give staff. So if you are able to budget it correctly, you will be able to understand and you will get what you want. In 10 minutes I can't tell you all those things, but still what you want, if you want to get, you have to have this understanding. And we at ANEI probably should do this. As a president, I understand my responsibility. I was a reluctant president, to tell you the truth. It is not that president's role make me feel any excited. Not really, not at all. Because any new role, you can say that that's great, but the level of responsibility and accountability for a role, every role, being CNO, it's not a easy role. You may think that what nice, everyone dreams of becoming a CNO so that you can boss over others. It's absolutely not. You become slave of everyone else. A lot of ANEI members are sitting here. One message which I always reply is of the members. I don't reply messages to my family members or even to my bosses at times, but never an ANEI member. This is the responsibility I have taken when I became. So many people have experienced that over here. Why? Because that is how you build trust in an organization. If this program today has become successful, it is because I understand that you have some trust in us, in ANEI, isn't it? Everyone sitting here who have contributed, all my EC members, you believe in a principle, we believe that we together can make a lot of things happen. That is business skill, I tell you. When collective power, when we realize it, that is business. Okay, so please learn it. Why I am saying this is, you please learn how the background of the story. How is it put together? If you understand that, you can influence everybody around. Every management is very reluctant to raise salary. We are telling him. Okay? This is for the past say 16, 17 years. There isn't a place where I change my job very often anyways. Okay, so people don't consider it as a good thing. So when I became a consultant, every 6 months I can change my workplace. That's fun too. If you realize some things, then it's fun. Anyway, I have freedom to do that, but however, so there isn't one place where I have not changed the salary for nurses. Every place I could improve the salary. This is only one thing which I feel great about being a nurse, that I could increase the salary of people. I have testimony to it. So many people are sitting here, so I am telling it with conviction that you can ask them. They are sitting there behind, and so many people here are experienced. So how do I do that? And it is not easy to. The cost per month, the last salary increase in their place is about 60-70 lakhs per month. That's not a small amount, right? You multiply into 12, you see how much of amount. So if somebody has to sign that, they have to trust you that this is worth it. So please make your management feel that what they spend for you is worth it. That is by taking accountability. And we have to shed this phenomena of accountability phobia among us. What is accountability? Be made answerable for the outcomes of your action is what is accountability. So let people ask you question. Why are you afraid of question? I've been questioned for everything. You keep trying. There is no end to it. So you invite questions. You question me, I will answer. The moment you take that posturing, that you ask me, I will answer. Not to my small nurses. Things will fall in place. And you actually take accountability for that action. And if something goes wrong, and many things goes wrong every day, you take accountability, own it up. You own it up. Go to the management and tell that, I'm sorry this happened, I take the ownership and I will see that it will not be repeated again. Instead of going and defending so much. No, you have to keep a pace with these two. You have to defend at times, yes. If somebody is abusive, you have to defend, no, this is not acceptable. You have to tell, looking at their face, that I will not take it. But at the same time, when something goes wrong with the nurse, every day it happens, right? Because we manage with very young nurses. Every day things goes wrong in amazing ways. We'll have to own it up. We'll have to plan back and how can we prevent it in future. Because there is a life at stake. Whatever we do, the nurses have to understand that it influences life at the bedside, right? Patients, and it's not one life, so many lives, right? So business skill is nothing but making inroads into our own brain, understanding the situation. And when you have that, our responses to situation will change. That is my message to you. I have actually slides. I did not want to present that here because I do not want you to think that business is Excel sheets and graphs. It is not. Business is understanding human beings. It is psychology. When you understand another person, when you understand your management, when you understand your CEO, your behavior will change. Because I was not only CNO there in that KIMS. After my contract is over, another person came and took over. The chairman said, there is a hospital, you go and become CEO. He gave me a ID card with CEOs. I had some more time left, so I went and accepted that. Anyway, thankfully I am relieved of that. I'm in one position which I don't want to be CEO's position, because you know why? Because it's very difficult for me to go and ask people to beg sorry every time. But this happens. So please understand what another person's predicament is. Be it a patient, be it a doctor, be it. Now I sound very strange, right? I am talking from the other side of the story. I am not fighting for nurses or asking for nurses. No, but you have to balance both. Then you become a good business person. Learn the bills of the patient. Explain it to them. That is being accountable. Okay, I'll stop here because others are waiting. Thank you so much for giving me this opportunity. I don't know whether you understood what is business skills, but some things to be noticed, be counted at. Thank you.
Thank you, Ajita. As always, we must learn from her how to be cool. You know, recently when I met her in Trivandrum, I asked her, being a CEO, are you stressed? She said, why? There is nothing to fear about it. She was very cool like a cuckoo. So, very nice. And frequent change of jobs. She's cool about it. So, there are many tips to learn from leaders, okay? So, being a businesswoman, at a place where you are a leader, you need to be thoughtful about your identity there. The resources availability, the facility, the infrastructure, whom you are reporting to. You need to stand out, you need to be firm, you need to be visible, you need to be affirmative. You are accountable for your actions. So, as a leader, you need to understand the whole concept of business there. Health economics, we call it. So, there is so much to learn in that. But at the end of the day, when we demand for things, we have to measure the outcome. Very interesting. So, our next speaker doesn't need an introduction. Madam is Ms. Shubhada Sakurikar, former National Secretary, ANI, all of you know it. And her topic is World Skills Exploring Opportunities. So I asked her yesterday exactly what you want to talk about this topic, what you do. And Madam Shubhada clearly told me, I'm not going to tell you now, I'll speak it on the dice. So you will hear from her. She has a long list of credentials. Advisor, World Skills, Health Sector Skill Council, Government of India. AVP Nursing Education, Apollo Med Skills earlier. She is also a graduate from RK College of Nursing, Green Belt to Six Sigma. Many awards to her credit. Julita B. Sotejo, Chair for Cardiovascular Nursing, and she also led JCI and NABH, crafted training initiatives at bedside, worked in health education in England, HEE for nurse requirements. She directed reskilling initiatives, and she is a thought leader at the NITI-IO for nursing practice improvements. She authored 2 books as well. She has written 2 books, Vision and Legacy of Florence Nightingale, The Way to Health. These are the 2 books she has written, and many other things to her credit. So you all know that she is, life member Infusion Nurses Society and founding member and member secretary for ANI from 17 to 22. So over to Shubhada.
Thank you, Josephine. Namaste, everyone. I had specially requested Josephine not to talk about my credentials because I firmly believe our credentials come out of our work, and that work is visible to the public because that's what it is all about. I might sound a little different off the beat for many people, but I do feel that work should speak for us, and therefore preparation of slides becomes, confining it to something together becomes very difficult. So please, thank you once again. And before I go forward, I hope I have 15 minutes with me. Ma'am Josephine?
Yes, yes.
Okay. Thank you. I would like to thank everyone, including the ANI leadership here, as well as the opportunity that came to me through my colleagues to organize this conference and give whatever support and help I could. I'm truly thankful for that. And I am also thankful for my young colleagues who are all here, who are taking this lamp forward. Of course, we don't have a lamp today, but we are taking it forward together. So with this brief introduction, I would first like to spend 2-3 minutes on why we have this track. When we were designing the ANEICON conference for us, we realized that the future depends on a lot of changed thinking, adaptability, flexibility, and the skills. Yesterday, I remember some of the speakers pointed out that we will become an extinct profession within no time, because if we do not change ourselves, fine-tune ourselves to the needs and requirements of this world, we will definitely become extinct. AI will not replace us, but others will replace us. Our other, the other partner human beings that are working in the institutions, they will replace nursing. There are so many mushrooming professions that are coming up because we need to change. We need to look at things differently. And that's why the genesis of this skill set which we have created here today, starting with business skills, and I specifically asked for this particular the topic which is given to me, which is world skills. I'm going to just share with you what I do there. And if you think as leaders and as general consumers of knowledge seated here, that it is of relevance today, you can think differently and act differently. That's the idea of this entire talk. So moving on, next slide please. As I said, the world is changing rapidly, and if we do not change with the world, we will become absolutely non-entities, because nurses are anyway not staying with us more than 1 year, isn't it? So we need to look at it differently. World Skills International is an organization which is a European organization, and they do have a bunch of skills with them. It is an organization which connects 1/3 of the world together, because it connects all the countries. It has so much of participation, and every day the participation is growing. Countries are coming forward and joining the choir. Now what do they do? We have already 85 member countries with us, and more are coming forward. What do? They connect everyone through skills. Now, generally if you ask any of the HR professionals, or even if you read about how the resources are placed, we will all realize that there are certain bands wherein there are very good professions, then second level, the third level, and then the fourth level, right? Skills somehow fall in the third level, not in the second level. Unfortunately, nursing also is moving between skills and the second level. We call it blue collar, white collar, and things like that, right? Are you all there with me? Yes. So, every time people think that skills are a little in the lower side. But we as nurses require skills as an essential element in our practice. And we have to take that part into knowledge component and move into the upper band, right? So world skills is an opportunity under the skill called health and social care. What does it do? It inspires younger generation. we are all now in the age group where our responsibility becomes to inspire, to promote, to give them or lead the way or show them the way, and people follow it. They also develop countries, because when we look at two different countries, and what happens is when some other country is doing something, then we learn from them and they learn from us, right? So it's also a development and it's also an influence. Because they influence, what happens is skills get a little higher recognition, right? So that's how it goes forward. They have a vision. They also have a mission and a position. They just believe in power of skills. Skills are all that they talk about, okay? And without skills, nothing exists. There are n number of skills which are getting added and n number of opportunities in those skills. But healthcare is a limited location which is called health and social care. The mission is to raise the profile and recognize the skills, and the position is to develop and to make an excellence in a particular skill. This is the leadership that I report to. I have brought it here so that, and believe me, all of you, I do pro bono work. If pro bono work is not understood, I am not paid for this, and there is a little story behind. The story goes like this. When my last employment happened, formal employment, I resigned in the year 2019, just before COVID started, for my personal reasons. And I was appointed by the chairman of my previous company to front end this particular responsibility with the WorldSkills, right? And when that happened, I thought that once I leave the employment, automatically that will stop, that should have stopped. But what I realized was WorldSkills got back to me through National Skill Development Corporation and Healthcare Sector Skill Council of India, saying that your appointment is not related to this activity through your organization. It is an independent appointment. And that's how I continued working with them, right? I had no idea, believe me, I was as naive as all of us are here today. But having gone there and worked with them for last 5 years, and now 6th year is running, I moved on from the national expert to a deputy chief expert of WorldSkills International, and currently I am the skill competition manager. Thank you, thank you very much. It means a lot to me because I front end our country. It means a lot, It takes a lot of pride to stand in front of that crowd, because I have a small video which I will show you. And how is this relevant here? Let me move forward. At a global level, there are certain parameters that we do, and also at the national level it is relevant. First of all, there is promulgation, and it motivates youth. I remember in ANI also, we were battling with a topic one of the days, saying that whether nurses would be interested to join nursing or not, younger people, because it's a very tough profession, right? And that conversations were there between us, and these kind of skills do give them a kind of a platform where they come, they value, they get recognition, and then themselves they feel empowered enough and confident enough to face the world. So that's something that is called promulgation. It also creates champions, because one person, believe me, we went into the competitions in 2019 and 2022. Both the times we got medallions of excellence, around 15 countries. So we are looking at the bronze medal now, and then the silver, and then the gold. Okay. It also creates partnerships between countries, between people, and I have created a big, circle of people with whom we can interact, we can share our knowledge, learn from them, and then bring it backwards. So my entire stream where I work with skills, I bring back that wisdom and share it with people. And then long-term associations. These are some of the national level activities that happen. At the global level, of course, there is networking, there is connecting, and there are other state-of-the-art preparation, because we don't have labs everywhere. Many of the places here who are seated, the institutions which are here today, they do have facilities, but there are some who do not have it. And then that becomes the standpoint, that becomes the level at which they can start working on their equipment and their infrastructure. Relevance to Indian context. Now here is a catch. The catch is like this. I'm not going to read the slide, but it's for your consumption. We as nurses, we require people to help us. We require a cadre which can do the basic job for us, so that we can move into the knowledge component which I was talking about, right? So this is the opportunity which we can use as health and social care practitioners, not nursing assistants. You see, today nobody wants to become an assistant. Everyone needs money, everyone needs recognition, and this is the cadre which can be prepared. And we are all working with different streams of government to make sure that this cadre gets into the fabric of Indian healthcare system. And government is very pro towards skilling, and that's how it's going to come. Whether we like it or not, it's going to come, because there are hardly going to be any nurses. So it is our opportunity to own them up. If we own these people, if we support these people, they will be sharing our workload, and probably in years to come, we will have someone partnering with us who can reduce our workload and leave us for our intellectual, critical thinking, problem solving, all those other elements that we talk about. We only talk about in the theory, we don't practice them, right? So all those elements can be left for us, and then there would be a fleet of people who can help us in this. That's the idea. So we want to spread the word. We want to sensitize nursing community first, because nursing community has to agree to do this. If they do not agree, then they are working in a silo. So this is where the genesis has happened, right? And then of course, we ran this as a test project, okay? Let me just share quickly with you. Is Lydia here in the audience? Right. Thank you, Lydia. She represents Kaveri Hospital, and just recently, with her, I am doing work in Tamil Nadu, and Tamil Nadu Nursing Council has given us complete permission to deal, to get this into the system, and we are going to represent India through Tamil Nadu. Okay, so that's going to be the first one. And Lydia is one of our partners, and we are also looking at more partners in future. This is all I have to say right now. There are some videos which you can go through. If you take a picture of this, you will get to know. Because of lack of time, I'm not going to play them here. But there is a short video. Can you please play it? Just for 3 minutes. Thank you very much. And I would be
원활한 행사 진행을 위해 소지하고 계신 휴대
sorry. This was noise, okay? I'm open for any questions, but maybe before the siren hits,
Yeah.
I want to go back to my seat. Thank you. Thank you, everyone.
I think questions we can take at the end. Yeah. So very interesting, and I really appreciate. I think all of us appreciate. It's a new. From a domain, she has shifted to an international domain, getting lot of global exposure. And in India, our government is so much looking into skill enhancement. Lot of activities are happening. So it's really good, and you are focusing on health and social care. That is the need of the hour. And any skill upskilling requires, as Madam Shubhada rightly said, critical thinking and problem solving skills. Also, we learn to work with team and collaborate with each other. That's what she mentioned in her talk. And we have to be highly professional and a strong work ethics, because we are sometimes working with other nationality, and Tamil Nadu is going to connect first. That's something very interesting. And I think communication skills also play a bigger role, whether it is oral or whether it is written. And at the end, being a leader, leadership skills. If you are a leader and you have good leadership skills, I think these areas will really suit you, and you can really get into it and be part of it. So I'll share with you one experience which we have done at our place. As Madam Shubhada said, in future nursing is going to be, very much in crisis with the shortage around. We did upskilling of 12th pass, young ladies who are coming to us unemployed, looking for an opportunity. So we had a batch of around 40. We took them on board, and they had absolutely no skills at all. And put them through a 3 months intense program. And now today's time, they are well groomed, they communicate well, they understand what is professionalism, at least to a small extent, and they participate in patient care with much more maturity and accountability, and they help nurses in basic non-nursing activities. So that they are called nurse assistants. So I think skilling anywhere you can really introduce. Thank you so much, Shubhada, for sharing with us. Now we have a speaker from CARE group of hospitals, Mr. Mayank Rutella. So Mr. Mayank, nice. And I was looking at the topic, building nurse leaders of tomorrow. So we are going to hear from an HR person, how to build a nurse leaders. That's something going to be very interesting. And yes, please over to the dais. And to build a nurse leader, it's not that easy job. So let's listen from him. So I just want to give a little bit more detail about his profile. He is working as Group Chief Human Resources Officer at the CARE Group of Hospitals, basically business strategy planning. And also he have international experience of heading HR in European, emerging markets and Middle East. And he led organization change management and HR transformation, HR leadership roles in various industries including hospitality sector, healthcare and financial services. Over to Mr. Mayank.
Thank you very much. Good morning, everyone. How's the Josh? Josh is high.
Yes, hi.
So I am, as they say, literally the odd man out today. Because one, I'm not a nurse. Neither am I a doctor. And hopefully I'm not a patient of AIG. So, but I'm really honored and privileged to be here, and I feel I am not really competent to address a gathering like this, which is, I personally believe, I don't think nursing is a profession. It's not a job. It's a passion. It's something that you have to do beyond the call of duty. So my dad was in the Indian Army, and I always give this example that those soldiers standing in Siachen and various other borders and fighting various wars, in some way nursing is a profession very close to that, because it's selfless, it's not very rewarding, unfortunately, and a lot needs to be done by the management teams across across private hospitals to elevate the stature of the nursing function which I believe it does not get what it really deserves. So as you have seen my profile, I am not really a hospital person. I have joined Care Hospitals about 3 years back, and before that I was in various other industries. Although not in many jobs, I probably moved 3-4 jobs, but I got an opportunity to work within the same company in different industries. So in the next 15 minutes, I would also like to share with you some of my experiences which are beyond healthcare, because most of you have started your careers and your education in the healthcare space and will probably work there for a long time. So maybe having an understanding of perspectives outside of the healthcare will be more interesting than getting to know more about what Care Hospital does, which we will touch upon. So this is actually a format that came from the association. So some of the slides I will move faster, but this is a statement that I want to start off with, saying people are born, leaders are made. How many of you agree to this? Yes, of course. Yes. So leadership is a trait which can be developed if you want to develop it. So if someone is a nurse and wants to remain a nurse and does not really want to get into a leadership or management role, then it's her choice or his choice. But if you really want to become a leader, you can. And there are various definitions of leadership. In my mind, leadership is the ability to enthuse people to do what the organization's vision or mission is. Yeah. So there are various leadership definitions, but this is one that I believe in. Just to give you another example, when I was working with the Tata Group, in that we have something called TAS, like just as you have the IAS, Indian Administrative Services. In the Tata Group, there was something called the Tata Administrative Services, where young, is that a... No. Because nowadays the speakers are less scared of audience, they are more scared of the sirens. So you have to be really watchful, and that last 5 minutes you have to run like the quick 1000-meter race. So I'm ready for that as well. So whenever that final signal comes, we'll rush fast. So I was saying, so in the Tata Group we have the Tata Administrative Services, which hire young talent from top colleges, and their aim is to groom them to become CEOs of Tata companies in 12 to 15 years time. So I joined Tata's at the age of 22, 23. By 35, 36 I am a CEO of a Tata company, and as most of you would know, Tata has more than 100 companies working in India itself. So that's the statement I wanted to start off with. Care Hospitals I don't want to talk much about, but we've really grown fast in the last few years. We've added 1, 2, 3, 4 hospitals, and adding one more in the next month or so in Vizag. So we've added in Indore, Aurangabad, couple of them in Hyderabad, and we are now close to 10,000 employees, which includes almost 4,000 nurses that work for Care Hospitals. So that's our quick background. That's the vision. We want to be trusted, and many of you would know, and that Care is known for being an ethical organization with good clinical outputs. That's our mission, to provide the best services for our patients and ensure that they recover fast and go back home without any complications. This is another slide which I wanted to talk about. It's never too late to do the right thing. Yeah, so some of you here in this room, if you have not started your journey of leadership, which is the topic today, I don't think it's too late. You can do it whenever you want, and like one of the previous speakers who is herself in a leadership, a business role, I don't think it's difficult, and I'll share with you some of the things that we are doing in Care Hospitals to ensure that nursing leaders become business leaders as well. Although nursing by itself is a complex and a leadership role, but in the corporate world, leadership is defined when you become the head of the organization, you are the CEO, and you decide business results, and you attend investor conferences, and so on and so forth. But as soon as even one person starts reporting to you, you become a leader, because for that person, you are the leader, right? So moving ahead, so these are very specific initiatives. We have done many more, but I thought it will be relevant for this forum that we have done in care hospitals in the last 2 years to develop leaders from within, and with special focus on nursing leaders. And in quite of our new hospitals that we've opened, we've managed to get one of our number twos or a nurse manager to become the nursing head of that unit. So that gives an inspiration to the existing employees that if you stay in this organization, you could take on senior leadership roles. So I'll share with you another non-healthcare example. I worked for almost 10 years with the Tata Group and with a company called the Taj Group of Hotels, and 10 years I worked with them, and now next 10 years I'm following them. I haven't heard or seen a single, they have now I think 150 hotels, not a single hotel head who they have hired from outside. So every hotel general manager in Taj is groomed from within. Just they also hire management trainees and all that, and they ensure, so that becomes an aspiration for someone. Why should a nurse stay with you if every year she says that you are hiring a nursing superintendent from somewhere else? Because she believes that even if I stay here for 10 years, I'm not going to become the nursing head. Might as well go somewhere else, go abroad, change my profession like many nurses do. So what we have done, the first initiative, we have launched something called the Emerging Leaders Program. We have tied up with the Administrative Staff College of India, and we run our nurses through a general management course which talks about P&L management, which talks about material management, it talks about people management, about how complex supply chain is in a hospital. You as a nurse would deploy a stent or a graft, but from where does it come, where is it manufactured, what is the cost price, how does the hospital make profit on that? All of that is covered in this course, and we've successfully covered over 30 people in the last 1 year. We also do regular leadership summits, just as you are sitting here. Most of you are at supervisory leadership roles in your units. We call our nursing heads to our corporate office, and a smaller gathering, make them part of the leadership forums in care. We also have, with some of you would have launched in your hospital, a buddy mentor program. So any nurse who joins is assigned a senior nurse to be her buddy or a mentor for a period of 6 months. And with some of these initiatives that we have taken, statistics say we have reduced the nursing attrition rate by 5% in the last 2 years. That's a huge number. When we share these with our investors and our board, they kind of said, oh, I don't think it's possible, recheck the numbers and so on and so forth. But we've been able to do that. Most of you would be facing a nursing attrition of maybe 50%. We are now down to about 35%. So that's, in my knowledge, one of the lowest in the industry today. And we have created faster career paths for our nurses. We used to have like 11 levels before you could become a nursing superintendent. 11 levels. Junior staff nurse, senior staff nurse manager. I mean, you will lose your breath if you count the 11 levels of nursing. So we brought it down to 7. So the message of nursing fraternity is that in the next, realistically, 10 to 12 years, you can become the nursing superintendent or the nursing head of a hospital in care. And we have demonstrated that with some of them taking those leadership positions. So these are some very, very specific initiatives that we've taken on leadership to ensure that our nurses take on business roles and leadership roles in times to come. So since I have a couple of minutes, do I have? Or?
Yes, yes, you can.
So I also wanted to talk about a topic which is very dear to my heart, which many of you would have heard, called diversity and inclusion. How many of you have heard? Okay. So how is the gender diversity of the group in this room today? Is it good, bad, low, high? Totally skewed. Okay, I can hardly look at people from my gender sitting there. How is the regional diversity here, like people from different states of the country? That will be balanced. How is the organizational diversity here? People from different companies. Is everyone from AIG? Then I'll run away from here if everyone is from AIG. Because I was told from different hospitals people are coming. So although the gender diversity in this room may not be high, but overall diversity is very, very high. So that is the culture of India. Our society is very diverse. Our workforce are very diverse. Now when you go out for lunch or a tea break, will the nursing people from AIG be served tea first? No. And from Apollo last? Yeah. We don't know who's from where. I don't think seats are allocated based on which hospital you come from, or whether you are the nursing head or the nursing manager or whatever. No rules, no hierarchy. Okay. So diversity is that we are all diverse. Inclusion is that we feel a part of this conference today. The challenge for you as leaders every day is to ensure that you create inclusion in your teams. If you are able to do that, trust me, your attrition levels will go down. Your nurses will work with you. I know it's easier said than done, but the least they will do, they will not abscond. 50% of our nurses who leave abscond. We don't know where they go. They have to find where they have left their uniform, whether it's in the hostel or whatever it is. So at least they will tell you, ma'am, मैं नहीं आऊँगी कल से. So the ability of a leader to create inclusion is very, very critical. Please develop that. You will all manage diverse workforce without doing any kind of a CT scan. I can give it to you in writing. 50% of you here would like to go abroad to work. Right? It's an open secret. If your nursing head is here, you don't have to tell where you have applied for. Having said that, if you want to go abroad, you will manage more and more different nationalities. So I used to work in a hotel called Taj Palace, Dubai, and we had people from 17 nationalities. The executive chef from Germany and a housekeeping boy from Bhutan or Bangladesh or Pakistan or wherever. So you will have to learn to manage diversity. That is how you will become effective leaders. Last statistics from my end, I personally have like a 60-member HR team. Okay. I'm not exaggerating, but not a single person has left unless asked to leave, unless it is an extremely, extremely personal reason to leave. Someone got married, went to Australia, someone's parents, father expired, so wanted to go back to hometown. So this is the culture we are driving in CARE, that connect with your teams, understand their emotions. They will, if they continue to work in India and in a private hospital, at least they will continue to work with us. If they get a government job, I'm told 5,000 government jobs are opening next month in Telangana because of the elections coming close by. So I hope this is not recorded and it reaches Mr. KCR. My car will be confiscated in the next traffic signal. So great, I think I'm finishing on time. It's 19 minutes 22 seconds. Thank you very much for your time and patience.
for finishing on time, and very great thing that you are doing, creating leaders in your workplace. So nurse leaders are getting groomed, they are trained, they are guided properly so that they can become future leaders. I know maybe after the session I talked to you, I had one of my nursing supervisors joined you, and she's now an operational healthcare. So in care group only, and she's extremely happy over there. So I think leadership is something very, very unique. When we identify people for into that role, when you groom them, we need to share with them the organization vision, our vision, and motivate them and inspire them. All of us need to become the role models so that they get inspired and motivated and they work towards the same vision, and at the end they become effective leaders of tomorrow. And nursing attrition, as you said, 35% at your place, on an average, the industry attrition is 30 to 35% even today. So good. So a nurse leader, once she is groomed, she also need to understand, especially for the youngsters sitting out there, we all have to think that we have our weaknesses and our strong points. We need to work on our weak aspects. We need to be positive and enthusiastic. And also we have to maintain good work morals, good values. That way the leader will stand out. And excellent communication skills. You also have to have the spirit of learning and to expand your knowledge. It is so important to be part of like this conferences, workshops, seminars, any events happening anywhere, because many times young mid-level managers, they don't motivate down the line their team and they don't come forward to be part of such training programs. And the last and very, very important, join professional organizations like ANI, like IMS. There are so many organizations within the country, even TNI, be part of it. Be inclusive than being an outsider. So moving on to the next topic and the last, we have a expert person on our panel, on our dais, Dr. Purnima Prabhakaran. So Dr. Purnima Prabhakaran have lot of credentials to her credit. Previous positions held additional professor, head environmental health and director, Center for Environmental Health and Public Health Foundation of India. So currently she is the director, Center for Health Analytics Research and Trends, Trivedi School of Biosciences, Ashoka University, and Senior Research Scientist, Center for Chronic Disease Control. She is MBBS, MSc Epidemiology from London School of Hygiene and Tropical Medicine. And she has also done PhD in Social Medicine, and she has done postdoc fellowships. So she also received many awards, Young Researcher Award. She has received Student Ambassador for International Program Award. She is a visiting researcher at University of Southampton, UK. And qualifications, of course, I told you, and publications are few. Focus on life course approach to chronic diseases, children's environmental health and environmental issues spanning air pollution, climate change, water sanitation and hygiene, chemical exposures and climate smart health systems. Very interesting field. Over to you.
Good morning, everyone. Thank you, Chair, for the kind introduction. At the very outset, I think I want to say thank you for two things. One, to the organizers who have thought of such an important theme for your conference here today, futuristic skills towards futuristic healthcare, transformational leadership. I think we live in times where we really have to reimagine the future of healthcare. And I think the nursing community has gone steps ahead by actually choosing this as the theme of your conference. So thank you and congratulations. Second, I also am very excited to be standing here before you today because as a doctor, I go to a lot of medical conferences, I talk to a lot of doctors. As a public health person, I go to public health conferences. I've also done the other extreme of talking to students, medical students, also to some extent in one or two occasions nursing students. But talking to the nursing fraternity I've been waiting for the opportunity. I think for the last 2-3 years, I've been looking for the opportunity to come to a nursing conference and talk to people like you, because I'll tell you why. It's very, very important. So thank you, and I want to say thank you specifically to Ms. Vinci Thrupuvan and Mrs. Tankam Gomez. I think she's just stepped up, because I have crossed paths with them in the last 5 years during my work, and they are the reason why I'm here today. So thank you, special thank you to both of you. Without further ado, I'm happy to follow on the footsteps of Captain Ajita Nair, who talked about business skills, and ma'am, you who talked about world skills, and sir about the importance of the nursing thing. I, for one, on a personal opinion, I do not want the nursing fraternity to go away. I mean, you have a very, very important role, and I don't know why I've heard 2-3 times that the nursing fraternity will become extinct. It worries me. So, because I'll tell you the reason why in the course of my talk. So, I was given the theme of green skills, and it's part of emerging concepts. It is, and to start with, I think some of you might be wondering. I'm sure most of you have heard this concept of greening, but if not, why green? What is greening? A lot of people think greening maybe the thing of planting trees maybe and making your environment green. It is part of that work, but this is a little different concept, and I'm really glad for the opportunity to be talking to you about this today. And this conversation cannot start without first talking about the issue of climate change. It's a very, very related issue, and therefore, pardon me, but I will take the first few minutes to just talk a little bit about climate change. I'm sure all of you are reading about it in the newspapers. You're looking and hearing about it in the news channels. You're probably hearing your children talk about it, because the younger generation has become very, very aware about climate change, and they're very worried lot. So let me start with just this concept of climate change for 2-3 slides, and then I will come to the topic of green skills. So the United Nations actually has declared this decade, 2021 to 2030, as the decade for ecosystem restoration. And just to bring us all on the same page, what is this when we talk about ecosystem? Ecosystem is everything. Us human beings, plants, animals, all of us who live and breathe on this earth, and the way we interact with each other. And unfortunately, the way we have been interacting with each other, sometimes it's natural causes, but sometimes it's man-made reasons why we are behaving the way we are behaving, or man-made meaning anthropogenic is the term we use, human causes. And what we have done is we've ended up degrading our ecosystems. And the blurring of those margins between human life, the plant life, animal life was actually the reason why the virus jumped species, and we were in the midst of this global pandemic which brought us to our knees, the whole world, COVID-19. And that is also a result of degradation of the ecosystems. Whether that's human or man-made, let's not get into that just now, but that certainly was a pandemic that brought us to our knees. What we probably are not aware of to the level that we should be aware is this other pandemic which has stealthily crept literally in our backyards now, and that is climate change. We are all aware that there is changing of the weather conditions. We are seeing changing temperatures, we are seeing more rainfall, the sea levels are rising, we are seeing a lot of different things that are happening leading to acute climate events. And this includes things like more and more floods, droughts, poor air quality in our cities, and lots of different acute climatic events that has led to this different pandemic that we are all probably not fully aware of, and that is climate change. And why are we talking about climate change? We are doctors, nurses. Why should we be talking about climate change? Let me tell you, it is being pegged as the biggest public health challenge of this 21st century. But it's not all gloom and doom. It is not all sad and worrisome, because we also look at it as a big opportunity. It is called also the biggest public health opportunity of this century. And why? Because of opportunities like this, where we have begun to sensitize the different communities about the problem, and therefore we now know that we have to act. So let me just show you this graphic. It's from a leading medical journal called The Lancet. Some of you would have read publications from this. And the top half of the graphic, this is what we call a heat map. You will see on top over there, it's not a proportionate thing. North America doesn't look like that. But what we are showing here actually is where are the countries that were responsible for the greenhouse gas emissions. Greenhouse gases increasing is the reason why we are seeing increasing temperatures around the world and why we are having climate change. And among those emissions, the biggest culprit is carbon dioxide. So if you see, it is the developed countries like the North Americas, for example, and the European Union, which are responsible for the greenhouse gas emissions in the past. But if you look at the graphic below, that is showing the health impacts. And that is something that we have to worry about, because it is the developing countries and countries like ours, Africa, which are facing more of the health consequences. So you will understand why this is something that we are worried about and why we need to take action. And just this one slide to show you what are those consequences of climate change on health. If you look at the center, it is the impacts, and you will see on the outer circle of that is increasing carbon dioxide levels. I don't know if I have a pointer here, but you can see increasing carbon dioxide levels causing rising temperatures, more extreme weather events I mentioned earlier, rising sea levels, and all the health impacts that you see on the outer circle, whether it's air quality causing asthma and respiratory illnesses, extreme heat causing heat-related illnesses. You see in a country like India, we are seeing more and more heat waves. Not just the numbers of heat waves, we are facing more frequency of heat waves, and when the heat waves happen, they last for a long time. Not just in Andhra Pradesh, in Gujarat, Rajasthan, Orissa, many states are facing these heat waves and droughts. So the impacts on health are vast. There's also changes in vector ecology. You know, mosquito-borne diseases like malaria, dengue, you must be seeing they are more and more now in every state literally in India. It was not this case before. So all of this is attributed to changing climate conditions. It becomes more favorable for the mosquitoes to move to greater heights, to move to all parts of the country. Water-related illnesses, of course, and not to forget mental health. You were mentioning, the chairperson was mentioning earlier about mental health. The impacts of people getting affected by acute climate events, droughts, floods, sometimes they have to move their housing, they have to move to different cities. And so the access to healthcare, the access to education, the access to food, everything gets affected. And post-traumatic stress disorders related to climate change, there's a new term called eco-anxiety. And that relates to the mental health impacts of climate change. So the health impacts of climate change are huge, and therefore communities like us who are working to deliver healthcare should become aware about what are the health impacts of climate change. And therefore, hospitals and healthcare facilities and health systems have to become what we call resilient, climate resilient. We have to, as healthcare providers, become equipped, become aware, and be able to deal with these health impacts of climate change. So this is one aspect, that is the resilience. But let's, I wanted to this, the organizer said there should be one landmark statement in your presentation, and I think I wanted to choose this. We repeatedly are telling everybody that the climate crisis is a health crisis. And the UN Secretary General Antonio Guterres, in the annual climate conference that happens every year in Glasgow in 2021, he said this climate crisis is code red for humanity. And I don't have to tell you, code red really means like smoke, fire. Our house is on fire. And therefore, it is something that we have to sit up and take notice about. So, coming to why these climate crisis is a health crisis, when we talk about greenhouse gas emissions, where are all these emissions? Who is responsible for all these carbon dioxide emissions? It is, of course, industry, it is agriculture, it is transport, it is the electric sector. But what about healthcare? Do we have a role? Don't we get trained to deliver care? We are people who do no harm. We are delivering care services to people who are sick. But unfortunately, if we talk about it, does the health sector have a role in climate change? And do we need to care? The answer really is yes. And why? This revelation came to us not so long ago. This was a groundbreaking report in 2019 that found that the health sector everywhere in the world actually contributes also about 5% of the global greenhouse gas emissions. And just to give that a little perspective, it is equivalent to the emissions from 500 power plants. That is the amount of emissions that comes from the health sector, and this was the report. And if we were putting all the hospitals in the world together and ranking them along with countries, we would be the 5th largest emitter in the planet. That's a very startling statistic, that the health sector also is responsible for greenhouse gas emissions. And how much? 5%. And if we ranked with countries, we would have the rank number 5. And so that is worrisome. So this is a figure that I would like all of you to walk out with in your minds. This is the hospital's climate footprint. You know, when we deliver healthcare, we need a lot of different things. We are dependent not just on ourselves, the personnel who deliver care, but we need everything. From a building, we need energy, we need electricity, we need water, we generate waste, we require food for our cafeteria and for our patients, for our doctors, for our nurses. We require transport, we have ambulances. We require the agricultural sector because we have food. We require manufacturers and suppliers of drugs and pharmaceuticals. So all of these different actors actually are contributing to a hospital's climate footprint. And if you look at countries around the world, India actually is among the top 10 countries contributing to the global greenhouse gas emissions. The top 10 countries, United States, no surprise, the European Union, China, Japan, and Russia, along with China, India, Brazil, South Korea, Canada, and Australia, are responsible for 75% of that health sector emissions. All the other countries in the world together contribute the remaining 25%. So we have a role here. So just talking about our Indian health sector's climate footprint, it's about what we call, just don't have to worry about the figure, 39 metric tons of carbon dioxide, but just to make you understand, it's about emissions from 10 power plants, that is or 8 lakh vehicles on the road. The health sector in India, that is the level of emissions that we are contributing. And what is important is that we have to work as health actors, we have to work to mitigate or reduce that climate footprint, and that is the concept of greening. So here is actually my topic, greening the health sector or reducing our climate footprint is important. It's an important aspect of healthcare and we all have a role to play. So together with resilience as well as mitigation is the concept of what we are now talking is climate smart healthcare. You must have heard of climate smart agriculture in different circles, but climate smart healthcare actually is these two concepts of developing resilience, becoming aware of the disease burden that comes from acute climate events, that is the climate prepared or adaptable health system, but this other one, which is decarbonizing or reducing the carbon emissions from healthcare, or green health system is what is the other skill that we want you to develop and think about. And so summarize actually, when we talk about what links climate, why did I start with climate change? Because there's increasing recognition of the impacts. I talked to you about the health impacts of climate change. There's going to be more and more patients coming to our hospitals because of this. But we also have to think about our emissions. And therefore, we need to build our capacities. When you talk about capacity building programs, or you're talking about ASCII, or you're giving trainings, it's important to include this because even today, both the medical curriculum and the nursing curriculum in India do not talk about climate change and its health impacts. Just look at the number of health impacts that I've enlisted for you. How come we don't have it in our curriculum? So all the leadership sitting here, if you are in committees where you are talking to the government about changing the nursing curriculum, please include climate change in the nursing curriculum as well. And therefore the question that we need to ask ourselves, are we prepared to deal with this new crisis that is there? The answer usually is no, and therefore this is a wake-up call. So we are seeing situations like this. Can anybody guess where this is from? This is a health facility where, because of floods, the patients had to be moved out. The floods inundated the facility. Yes? Correct. Chennai floods, December 2015, and this situation also played out 3 years later in Kerala. And it's not just India. This is a similar situation in South America. Hurricane Maria in Puerto Rico, similar situation. The patients are being shunted out. That's the wildfire in California. So all of these are acute climate events. So really, I always say climate change is an equalizer. It doesn't spare developed or developing countries. It happens everywhere. But what is the challenge we have in India? We don't have a single health system. Those of you who are familiar with the UK, it's a single national health system. In India, we have this strange health system where we have private hospitals. We are standing, if you look at that side, multi-speciality hospitals, we are sitting in one here today, multi-speciality hospitals, but you also have the public health system under the state governments. You have the medical colleges, hospitals, district, community health centers, down to primary and public health centers. Not to forget, Captain Nair, you also have your defense hospitals, you have the railway hospitals. So where do I start if I want to start this conversation about climate smart healthcare? I need to start by talking to people like you, because you are there in every kind of health facility. And if you can start this conversation when you walk out of this room today, I would have maybe touched everything over here. The other challenge actually in India is that we always call ourselves countries within a country. We live in this very diverse country which has got so many states with different climate zones. So they are going to each have a different disease burden. Take for example Maharashtra or Gujarat. You have 3 climate zones over there. So disease burden can vary across states. So really if we want to empower the nursing community or the doctor community, we have a huge challenge. Every state will have to have a different customized action plan. So I wanted to say, we talked about the private hospitals. How are we reaching the private hospitals? The government hospitals, it's because I work with the Ministry of Health, Government of India, who now have a national program for climate change and human health. And in the private hospital sector, we have partnered with this organization called Healthcare Without Harm. They are present in every continent, literally. And we have been working with them since 2016, and they have the global green and healthy hospitals. We have established that in India. We call it the Health and Environment Leadership Platform. And Annie is actually a member. Thank you, Mrs. Tangam Gomez. You have joined us also as a member. By virtue, it's non-financial. You become a member, you get access to all our resources. Please visit our stall outside. I'm not sure what the stall number is, but I have 2 colleagues from my team who are actually sitting in a stall with all the information about green and healthy hospitals in India. Please do visit the stall. So what I wanted to tell you about is, we all know the health sector is not going to diminish. After COVID, more money was poured, little bit more money, and about strengthening the health sector. The health sector is only set to grow in India, and they are going to grow means that we're going to have more hospitals, we're going to use more electricity, we're going to use more water, everything is going to increase. So how are we going to deal with this problem? We need a health sector adaptation response. Okay, do I have to stop or 2 minutes? Okay. So we have a critical role to prepare ourselves to deal with the disease burden related to climate change. We also have to develop our coping capacity. Imagine a situation like in Kerala and the floods. The health facilities, the PHCs were just washed away. How do we deal with a situation like that? We have to learn from lessons that have happened in the past. So we need to develop our coping capacity. We have to become not only structurally strong, as in strong infrastructure, but we also have to become functionally resilient. We should be the last building standing. How is that going to happen? We have to have strong hospitals, strong infrastructure, and equipped healthcare personnel who are going to be able to deal with these issues. And India has demonstrated strong leadership in many other programs, universal immunization program and all of those different things. Can we also become climate resilient and environmentally friendly healthcare facilities in India is the challenge. And in 2015, actually, many of you might have heard about the Paris Agreement. This was the conference of parties, the climate conference which happens annually. In 2015, the Paris Agreement was signed asking everybody, every sector, transport, industry, everybody to take action. And there was also a call to mobilize the health sector as a climate leader to take action about this climate change. And who is the health sector? Is it just the doctors? No. We all have a role. And I was trying to list in one hospital who are all the different actors. So there's doctors, there's nurses, there's laboratory, OT, pharmacy, housekeeping, sanitation and hygiene staff, infection control, food and cafeteria management, procurement team, quality control team, suppliers of goods and pharmaceuticals, and many more. I might have missed a few over here, but all of these individuals have a role to play within the hospital. And the guidance comes from many sources. I will just rush through these, but there's guidance like this that has come. This is a World Bank report with Healthcare Without Harm, where in 2017 they gave us information about how to take action across all these sectors, our building design, our energy efficiency, maybe transition to renewable energy. We are a sun-kissed country, so why not leverage the solar power that we have and use solar panels, sustainable transport and water consumption possibilities. There's also guidance from the WHO, and they also have similar guidance, but they have these 4 pillars of action, and I want you to definitely focus on this one, the health workforce, which includes people like you, to make you skilled. We talked about skills, but also to become tuned to respond to environmental challenges. And India was not far behind. In 2008, they had the Prime Minister's Council on Climate Change. But if you notice here, the 8 missions that they had in 2008 did not talk about health. And the health mission came only in 2015. So I'm done here. So this is the last 2 slides. So we are working with the Ministry of Health under the National Program for Climate Change, and these are all the concepts that we are talking for action. These are the different areas for action. And starting from primary healthcare facilities to private hospitals, everybody has started working with us on all of these aspects of greening our healthcare facilities. And I put a slide here to say, what can you do? And this is leveraging this framework. There are multiple actions. You are at times working in a ward and making the indents. You can easily say, I don't want to indent plastic gloves. I want non-PVC gloves, nitrile gloves. We managed to do this in the GEM portal. Many of you are aware, your procurement has to happen through the government e-portal. They have replaced the plastic gloves with non-PVC gloves. So it's simple actions at your level. How you manage your waste, how you manage your water, how you manage electricity can go a long way. And I want to also point out the sustainability committees. We're going to have a webinar soon on June 5th on World Environment Day about a suggestion for every hospital to actually have a sustainability committee. That's where probably your actions can be done and started. And you can take incremental, you cannot do everything at the same time. You can start with one thing at a time depending on your funds. Maybe you can address energy use, maybe you can address water use, maybe you can address waste management, but you can do a lot of things. And I'll just rush through the next few slides. I did promise to share best practices from around the country. This is examples of small healthcare facilities around the country that have gone a long way to take little steps that have made a difference to not just the healthcare workers, the doctors, the nurses. They're also more comfortable because these are buildings that are optimizing natural lighting, natural ventilation, and they're also able to deliver better patient care. So a lot of examples from cold chains to baby warmers to dental units that have functioning only by using solar, actually. So I will leave my slides with you. The middle top row there is actually a boat clinic in Assam. If there's anybody from Assam, the Brahmaputra river, actually you have these boat clinics that were not able to deliver good care, but now they have solar on the boats. So they're able to actually reach out to people. And this is a hospital in Bihar built during COVID, based on green principles. A hospital that was optimally lighted, ventilated, but also the walls of this building are made of compressed agricultural stubble. You heard of stubble burning that is contributing to poor air quality in Delhi. We use that stubble to make the walls of this hospital. Okay? So, and there was savings actually in terms of electricity in this hospital. So really, really good examples. This is East Garo Hills in Meghalaya. This is a hospital in Jharkhand, St. Joseph's Hospital. All of them have shown energy savings but also cost savings. And there's ownership. Even the nurses, the healthcare personnel are getting involved in all of these initiatives. So there's a lot that can be done by you. And I want to say that we are not alone here in India in this initiative. This is a global campaign now for transitioning to zero carbon healthcare. And this one thing, Mrs. Tankam Gomez, we've had a conversation on the Nurses Climate Health Challenge, which is being done in a big way in the US. I think we need to bring it to India. And I'm sure I have your support if we want to take this forward. And this global roadmap for healthcare decarbonization is also a document which helps a nation, a national government to actually take steps towards reducing the carbon emissions from healthcare. And every nation has a role to play. We started this journey back in 2019 when we held a national conference on the role of health sector and climate change. And this had its endorsement from the highest level of leadership. We presented this report to the then health minister as well. But I think going forward, we have one earth that we need to protect and all of us have a role to play. We have World Environment Day coming up on June 5th. The theme this time is to beat plastic pollution. And I hope all of you will have a role to play starting today to at least think of some of these concepts of green skills and take it forward at the level of your hospital or your healthcare facility. We would have been one drop in the ocean, but I think we will move the health sector in India to a better place. Thank you for your attention, and I apologize for the extra time.
Thank you, Dr. Purnima. What a detailed talk on this new subject. I think this is one area we are not so familiar, not done enough. Need to learn more. I was just listening to you. My interest is there. I'm sure all of you sitting out there are, thinking about something to be done in this field. So why it is connecting to us? when you see the number of health problems which are coming up, which are preventable when we really focus on this particular subject, a lot of diseases can be prevented. And nurses have a huge role to play in preventive health care. And that is the time coming, because nurses are requested to move towards the rural areas and reach out to people and do how much they can in every,
Sorry, I will indulge you. Just make one more statement. So I work very closely with the WHO Geneva also, and the lead of the climate change team, Dr. Diarmaid Campbell, as well as the WHO Environmental Division Head, Dr. Maria Naira, they have always said doctors have a very important role, because yes, they are treating the patients, but even, and patients listen to doctors, but even above the doctors there is one group, and that is the nurses. So you really have an important role. I just had to make that statement, so that's why I said thank you for the opportunity to be here.
For that statement. And this year, 2023 International Nurses Day message, the President, Dr. Pamela Cipriano, she said, nurses, we call them, especially during this COVID time, we say they are the frontliners, they do everything. But she has called upon the world leaders to give them the power, empower them, invest in nursing to make them as frontliners for change. So you are talking about climate change, so I think that's a good message coming from ICN as well as listening from you. So 4 green signals, 4 green skills from your topic, what I read to: reduce, reuse, recycle, repurpose. I think that will help a lot to preserve this nature where we have to survive. And all of you have delivered your lectures so nicely. It was great learning. I'm sure out there everyone enjoyed listening to all of them. So thank you. Time is up too. Otherwise we could have taken questions. Thank you, Anita. Thank you, Shubhata, Mr. Nayak, and Dr. Purnima. So thank you so much. Thank you. Any questions? We can take maybe one question. 1 minute. Yeah. Yes.
I think my voice is loud enough. Quick. Based on the last presentation, a majority of the over 50% of the climate impact in carbon emissions comes from sectors upstream of us, right? So what are the simple hints to actually reduce that? Because we can't really influence pharma companies and biomedical companies to change a lot of their behavior when the average hospital in India, including the corporates, represents less than 5% of the industry.
I'm glad you got that point. Actually, the health sector's supply chain actually contributes to the biggest component of the health sector's climate footprint. But I want to just say that you have a very important role. As the healthcare providers, if we create demand aggregation, so business skills you're talking, if we say that we will only buy products that are produced, manufactured and supplied to us in a sustainable fashion, only then we will procure from it. So that can change the way production happens. So we are actually doing this as part of our work, talking to manufacturers and suppliers. India is known as the pharmacy of the world. 90% of UN's procurement of drugs and pharmaceuticals comes from India. We are supplying drugs and pharmaceuticals to the entire world, and the environmental footprint of that production is for us here in India. Not many people realize that the drugs are going to other countries, even the vaccines. But what happened at those production units is very important. Maybe the wastewater is going to the outside. Maybe antimicrobial resistance is happening because of that. So why don't we make that change happen by building that demand only for sustainably produced products? So we are looking at energy efficiency in medical equipment. We are looking at the pharma sector also, telling them that they have to include ESG in their production facilities. Only then doctors and nurses and healthcare facilities will procure from them. It's not just the drugs and pharmaceuticals, it's also the supply chain transport. So if we are going to be telemedicine, you mentioned telemedicine, definitely if you can make telemedicine an option for people who don't have healthcare, so you're going to definitely reduce the transport footprint. So there's very many ways, and definitely the health sector cannot work alone to do this. We have to partner with other sectors. It's a very intersectoral kind of.
But still long way to go. Thank you. Thanks everyone.
We thank all the dignitaries. We especially thank the chair and the speakers for artistically enlightening us on improving our business skills and throwing light on emerging concepts and green skills. Thank you, ma'am. And may I request all of you to pose for a group photo at the ANEICON photo corner.